Hi, my name's Helen Rumners. I'm the owner of My Nurse's Life and one of the lead OSCE trainers here. And we provide training every week in Wirral, near Liverpool, and also in southwest London every fortnight. So I've been running this for 7-8 years, and for the past 8 years I've developed this course from being asked originally to train for a company, which was one of 2 companies back then that were providing training. I realised that nurses needed to have a practical course where they could be assessed rather than just be lectured to, and that was the feedback I was getting even in those early days. The nurses really wanted to practice and they wanted to be assessed and get feedback. So my whole course has been created around that model, and at the moment there are quite a few companies springing up, but we do believe we're still the only company that assesses nurses for every single station, and this is so that nurses can actually demonstrate to us their skills and their competencies, so as they would in the exam, and not just a case of them being overloaded with information in a short time and then being expected to remember everything, which is virtually impossible. So also that the course is what we call blended learning. So it includes an online course which the nurse is expected to complete prior to training, or if possible, if that's not possible, to complete part of it and complete the other parts of it before their exam. So we do recommend you give yourself some time before training and before coming to training, and after that before going to the exam. So the good time period is probably about 4 weeks of preparation, and during that time you would be able to use our online platform. This has been recreated recently onto a different platform. So I looked at what we had already and decided that it needed streamlining a bit. So it's now much more user-friendly, and I have also made it more concise. So there's less repetition, and I've included another patient as well. Everything that's in the OSCE is included in this online course. So we didn't do the full 12 patients, but you will see the different patients that have different forms. So in this training, you're exposed to actually what is in the OSCE and what you could encounter. So when you go to the OSCE, you would feel very familiar with the forms and the patients that you encounter. So what we, as I was saying, is that we provide blended learning with online as the first phase of it. And then there's also virtual training. This is conducted with one of our lead OSCE trainers. So we do this every weekend for adult nurses, but we also do it for mental health and paediatric nurses. We don't cover areas that we are not competent in ourselves. So we're not providing midwifery training as a non-midwife. And when our midwife is ready to come back from her maternity leave, we will again be providing midwifery training. But that's one of our core ethics, is that we as trainers ourselves are competent in these areas, and that we have worked in these areas of adult mental health and paediatric training. So we feel that we are able to deliver this to the standard that the NMC would say that we are competent. So the self-study part of the course would probably take a nurse around 4 weeks if they were to take it easy and do an hour or 2 a day, which is the way that we would recommend that you approach this training. There's lots of videos in there. There's forms that you need to be competent in and that you understand how to use and what to do with that information. So for you to be able to process all this, you need to give yourself time. Also, the virtual training is to be done in a couple of days with one of our lead trainers. So this also need to come to that training fresh, not after a night shift, and give yourself time to sit down and quietly listen, and you can take part in the training rather than trying to do it while you're busy doing other things. Face-to-face training is the main part of the course, and this is the 5-day face-to-face. So during this time, you will again be taught the stations that you've already become familiar with, hopefully, through the online and through the virtual training. And then you will see these demonstrations given in a perfect way by our trainers. Then you will be asked, and some teaching around that, and some of the faults and mistakes that people make that cause fails, and what the examiners are looking for in terms of our communication skills and our competency skills and safety. So during that time, you will also be demonstrating back to us. You will give return demonstrations. We will mark you and assess you and give you feedback in a workbook. The workbook is for you to take home and to keep using up till your exam. I get often asked how long between training and taking my exam should I expect to leave, and I usually say 2 to 4 weeks. So either the whole process should take you about 4 to 6 weeks, the whole process of preparing for the OSCE. The OSCE now is a much bigger exam than it was previously, and if people are giving you advice how long it took them to prepare, it may be that they took the legacy OSCE, which was 6 stations and did not have anywhere near as many clinical skills, did not contain evidence-based practice and professional value silent stations, which is a huge part of the exam. And although only 2 stations, there's 30 different criteria to learn. So you do need to give yourself time and put the effort in, and you should be able to pass this first time. The thing about our company I'd like to also point out is that we only concentrate on OSCE training. We haven't diversified into other trainings, and this is not because we can't, because we do have competencies in other areas for training, but it's because we really want to make sure that our nurses get all the focus and that we stay completely on track with our own competencies and making sure that the course is developed in the best possible way. And we are not recruiters, so we do not involve ourselves in finding jobs for nurses. So again, if you are sending nurses to us, you can rest assured that we do not offer them alternative work while they're here. So our pledge to you is that we will help you throughout the training and beyond up to the exam. And if for any chance you need a resit, we're also there to guide and help you through. And I'd just like to say at this time in February 2024, our pass rate is in the high 80s, which is extraordinary considering the pass rate is around about 50%, if not lower generally in the OSCE test centres at the moment. So as long as people follow the course, they are more or less guaranteed a first time pass.